And so in the interest of time, I will dive into this subject right away, and I will talk about the effects of vasopressors as well as hypothermia on the immune response in sepsis. So to dive in, it's clear, and we know very well that epinephrine is inhibiting the innate immune response. And this is a huge effect. This is an in vitro study showing that if you expose cells to endotoxin, lipopolysaccharide, they produce pro-inflammatory cytokines. And if you do the same thing, but then at the same time, adrenaline, epinephrine is there, this response is greatly inhibited. And it seems that this is mainly mediated by the beta blocker, by the beta receptor, because a beta blocker can actually completely inhibit this effect of adrenaline, while an alpha blocker does not show this effect. So why is this of possible relevance? Well, we now know that sepsis is defined as a dysregulated host response to an infection. And that means that some patients may have hyperinflammation. And in those patients, there might be organ dysfunction, for example, as a collateral damage based on the hyperinflammatory response. But there are other patients in which the immune response is actually severely suppressed. And that's called even immunoparalysis. And in these patients, there might be secondary infections, and this is related to higher late mortality in sepsis patients as well. So immunoparalysis is a bad thing in sepsis as well. So if adrenaline has these effects and we are treating our sepsis shock patients with norepinephrine, could this also have this unfavorable effect on the immune response? And there was so far no human in vivo data available on this topic. So if I take you through the in vitro, animal, and the human data that we have, let's start with this. So clearly, if you indeed have noradrenaline at the same time there, and you stimulate cells with endotoxin, you have a great reduction of the pro-inflammatory response, as you can see here by IP10 and TNF. This is, again, inhibited by beta blockade and not by alpha blockade. So norepinephrine is mainly an alpha agonist, but still there's a little bit of beta effects, and that is actually mediating this effect. And the opposite is true for IL-10, the anti-inflammatory cytokine. So this is induced by norepinephrine, and this again is blocked by beta blockers and not so much by alpha blockers. So we took that to an in vivo model in mice. So what we did with use of this little pump, actually it is, that we could implant in the mice as a rucksack, you can actually add norepinephrine or some other vasopressor to it, and then very slowly by osmotic forces, you can connect that to their vascular system, and they have a very steady, sustained exposure to this drug. Then we gave them endotoxin, and we looked what happened to these mice. And again, we found that indeed there is a huge pro-inflammatory response in the placebo-treated mice. And if you give a small dose or a higher dose of norepinephrine, you inhibit this pro-inflammatory response, and you actually are augmenting the anti-inflammatory response. And this is not the case for all vasopressors. So we did also control experiments with vasopressin, and as you can see here, there's no significant modulation of the immune response by a therapeutically used dosage of vasopressin in these mice. So we took it the next step. So this was endotoxin. It's a dead material, but we also looked at a real sepsis model with the CLP model, in which the mice actually have a real infection. And again, we looked at bacteria dissemination, and we found that indeed, compared to sham surgery, CLP induces bacteria in different organs. And if you combine it with vasopressin, nothing much happens. But if you combine it with norepinephrine, there is an increased dissemination of bacteria in the spleen, the liver, and the blood. So this is of clinical relevance. There's an inhibition of the immune response, and that translates to more pronounced bacteria in different organs in this CLP model. Now, what about humans in vivo? So what we can do in healthy volunteers is give them a very low dose of this same endotoxin derived from E. coli bacteria. It's dead material, it's a safe method, but they will have this inflammatory response. And then we can also give them a very low dose of a vasopressor, a very low dose because of the hemodynamic effects, of course, in these volunteers. And thereby we can see indeed is the immune response in humans in vivo modulated by these vasopressors. And so this is at the start, the volunteers looking pretty happy, but actually they do get sick, and I have a short video to illustrate that. So you can see here that they are shaking and shivering following the endotoxin administration, and they feel sick for a couple of hours, but they all get better and leave the room at about 8 hours later. So you can see him shaking here. Let's see if I can show you another one, because it's pretty impressive. This is another experiment. So the innate immune system is actually recognizing the endotoxin, and so a huge inflammatory response is mounted. And these volunteers, they do develop a fever, and they are shaking and feeling sick for a couple of hours. So that's the effects of the endotoxin. So when we then measure serially the cytokine production, and we look again at pro-inflammation and anti-inflammation, as you can see here, there's a huge increase. These are really high numbers. And vasopressin did not significantly modulate that pro-inflammatory and also not that anti-inflammatory response. However, we did tests with norepinephrine and phenylephrine, and you can see here again that there is a huge suppression of the pro-inflammatory response, and there is induction actually of the anti-inflammatory response, as we did see in vitro and in the animal experiments. So does this translate to patients? So we went back to our biobank of septic shock patients, and we looked back because some of these patients used a beta blocker because of cardiovascular reasons pre-existently to their septic shock. So we had 129 patients on norepinephrine with sepsis, and we had 66 that prior to their septic shock, they used a beta blocker. And we sampled them within 24 hours after the septic shock diagnosis, and indeed we found that those that were on norepinephrine, they had a suppressed pro-anti-inflammatory cytokine ratio, and if they were using a beta blocker pre-existently, this was less pronounced the case. So again, the beta blocker is actually restoring the pro-inflammatory response in sepsis, and we could even find a dose-dependent result, because the amount of norepinephrine that was used is related to more pronounced decrease of the inflammatory response. So more norepinephrine means that more suppression of the innate response is there. So we think this is of relevance, because if a patient comes in with sepsis, we know that sepsis by itself suppresses the immune system. We know that disease severity is a very important driver of that immune suppression, but these are things that you cannot modify. This is how the patient comes in. But norepinephrine also strongly suppresses the immune system, and this is, of course, a modifiable factor because you have choices of other vasopressors that you could give. So the second part of my talk is the Iceman project. This is about the hypothermia part and the immune system. So as I told you, epinephrine is also part of your sympathetic system, and you can release it yourself, and it's a huge suppression of the innate immunity. But the thing with the autonomic nervous system is that it is autonomic. And then if you look that up, that means that you cannot voluntarily influence that system. You cannot bring up your adrenaline by will. And so this is not really relevant, you would say, in real life. Let me introduce you shortly Wim Hof, aka the Iceman. This is a Dutch daredevil that has 23 records in the Guinness Book of Records, all related to exposure to cold. I have a short movie to illustrate this. So he climbed the Mount Everest in shorts. He has the record for swimming underneath ice. He ran half a marathon barefooted through snow. And the thing is, he can teach that to others. He's not alone anymore. Oh, sorry. And his claims are that he can do these things by modulation of his autonomic nerve system. That is what he says. And by the way, I can also modulate my immune system. And we know that is not possible, of course. We cannot modulate the immune system. So he was actually in our hospital, standing in ice cubes. And what we did because of this claim of his is we took blood prior to ice exposition, and we took that blood and put it in a stove with endotoxin. And the next day, we looked at the cytokine production. And we did the same following the immersion in ice, and we found a huge decrease of production of TNF and IL-6. And this is after 24 hours in a stove at 37 degrees Celsius. So it's the same circumstances, and so there's a pronounced reduction of this pro-inflammation. So what we did was we actually found volunteers that were willing to undergo this experiment. So this was the first group, and this was the second group. And they went with Wim Hof to Poland, where he has a small farm where he could train these volunteers. Again, these are impressive movie clips, what they do. And I will focus on the cold exposure. So they would be naive to all this training, these volunteers, and they would be standing in snow, barefooted, learning the techniques of Wim Hof. They would be lying in snow for 30 minutes and more every day. And so they would be training like this for 5 days and then come back to the Netherlands for the endotoxin experiment. The end of the training, I will skip a little bit before, this was a small lake. And so Wim said, I want them to swim underneath ice from one hole in the lake to another hole. I said, well, should we do this? I'm responsible of these volunteers. So let's put a rope on them at least. So if there's anything there, you can pull them back. So these were people that never did this before. It's amazing how they were able to do this. They were swimming in ice, underneath ice in water of 0 degrees Celsius by definition. And the very last day, they climbed a mountain. Here you see it. It was a mountain that was 1,600 meters high. It was a very windy day, so also taking into account the chill factor, that meant that they were exposed to minus 27 degrees Celsius. That is extremely cold, and they were wearing shorts and shoes. That's it. And they climbed this mountain, and it took them about 3 to 4 hours. You can see on the long hair of this guy standing here how it's windy. It's really storming. And he's not getting inside to warm up. He's waiting on the other ones to all be there at the top. And then they would use their slide to go down again. You can see the ice on their legs. It's amazing. Everybody completed this task as well. So they were trained and they were exposed to cold. And then they would come back to the Netherlands, and we would do again an endotoxemia experiment. There were other things that they did, breathing exercises. I will show you in a minute, but I want to focus on the hypothermia. So this was the mountain they climbed. This was the tourist folder. This was what it looked like in real life, and just some impressions to show that they were all there exposed to cold. So when they came into the hospital, we would do the endotoxin experiment again. So you see the volunteers, they were not exposed to any cold or anything during the endotoxin experiment, but they were exercising their breathing techniques that they learned as well. And as you can see, he's hyperventilating at this moment. And this is what they do. They hyperventilate and then they stop. hyperventilation at the end, and they just do whatever they feel doing. So you can see here in purple, at the end of the hyperventilation, his oxygen saturation is 100 degrees. He gives a signal, I'm ready now. We take an arterial blood gas, and this is his values. There's extreme respiratory alkalosis, extreme. Very low pCO2, very high PO2. Oxygen saturation is 100%. Then they would do a breathing arrest. They would just stop breathing. And they could do this for as long as they liked. This is his oxygen saturation, 58, 57%. He says, I'm ready again. We take another blood gas, and now he's still in respiratory alkalosis, but this is his arterial PO2, 3.4. It's extreme low. Saturation is 52, 51. He's not feeling anything. He says, I'm fine. He's taking a breath. It's 48. It's 47. So we had extremely low oxygen saturations right there. So what is the effect on the autonomic nervous system? This is the adrenaline levels that we measured. This is the control group. So they were administered endotoxin on TS0, and then they get sick at TS 1.5 hours, and then adrenaline as a stress response goes up. But in the volunteers that were training and doing these breathing control things, there was a higher adrenaline level to start with, and then the breathing exercises actually increased this adrenaline level even higher and stayed high all the time. 2.0 nanomolar per liter. This is an extremely high adrenaline level. In another crazy Dutch study in Amsterdam, they actually had people bungee jumping that never did it before, because you get used to it. And they also measured their adrenaline levels when they actually came down. And as you can see here, they had adrenaline levels of about 1.2, 1.3. So breathing exercises like this is more stressful than bungee jumping for the first time. Then normally, as what we see in endotoxin kinetics of the cytokines is that the pro-inflammatory cytokines increase first, and then this is answered by the anti-inflammatory cytokine response in IL-10. But I want to start with the IL-10. So normally this one peaks at 3 hours following endotoxin administration. But in the healthy volunteers that were doing the breathing exercises and that were exposed to cold, they had a huge and early increase in IL-10. As you can see here, the area on the curve doubled. What we found in the pro-inflammatory cytokines that normally start earlier was that indeed it was inhibited almost by half for all these pro-inflammatory cytokines in the group that were doing these breathing techniques and were exposed to cold. So there was a huge suppression of the pro-inflammatory response. Then we thought, well, maybe it's that peak in adrenaline that is actually inducing that peak in IL-10. So we correlated that, and indeed we found a very good correlation that the higher the adrenaline level, the higher IL-10 was. And then we thought, well, maybe the IL-10 is responsible for the suppression of the pro-inflammation that normally comes earlier, but in this case comes later. And indeed, we found statistically significant negative correlations. The higher IL-10 was at the beginning, the lower the pro-inflammation later on. So the conclusions are that it is possible to voluntarily influence your autonomic nervous system and the innate immune response. This is amazing. This was the first time ever that this was shown in humans. And this could represent a novel, non-pharmacological, non-invasive treatment. You can actually modulate your immune system by exercising these techniques. And so we got extensive media attention for this. We were all over the journals and the TV programs. Actually, maybe some of your kids are in high school, and this is the American high school biology book, I'm told, and we are in that book actually testing the Iceman. And they use that actually very nicely to explain how hormones could influence the immune system. We got more media attention, and I want to end with this one. Which one is out of place? Pamela Anderson, Jenna Jameson, or Matthias the postdoc and me? Well, it's clearly Jenna Jameson, because Pamela Anderson was in Playboy. And so were we actually, because this whole story on testing the Iceman was, we were interviewed by a journalist and he got that published in Playboy, The Iceman Cometh. And so we have a couple of pages right there. It's not available on PubMed. But nevertheless, we think that this actually has the highest impact factor in 2016. This is the rating, and we think is indefinite. So to conclude, catecholamines, both epinephrine but also norepinephrine, either administered as we do in our septic shock patients or by endogenous increase if you exercise these techniques, they inhibit your immune system big time. This is a huge effect. And so we think that this could contribute to the immunosuppression that we see in sepsis patients that we treat with norepinephrine. And this may negatively influence their prognosis. So this is an interesting area that needs to be looked into further. Many people help with these studies, as you can imagine. I thank you for your attention. This is our research group. And if you want to look up the papers, we published the norepinephrine studies in the Blue Journal and the Iceman studies in PNAS. Thank you very much.